Bonjour et
Good afternoon, and thank you for being with us today. To all healthcare workers on the front lines, we recognize that it hasn't been easy for you. This is National Nurses Week, and we'd like to thank nurses across Canada who do exceptional work every day, particularly in the fight against this pandemic. Thank you for everything you do to keep us healthy and safe. You are our real heroes.
Canada's frontline healthcare workers, we know that this is a particularly challenging time. This is National Nursing Week, and I'd like to thank all of the nurses across Canada who are doing exceptional work every day, and in particular during this fight against the global pandemic. Thank you for everything that you do to keep us safe and healthy. You are true heroes, and we appreciate it so much. So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, le Président du Conseil,
The President of the Treasury Board, Mr. Duclos.
Patty Haidu, is here to answer your questions as well. Dr. Tam, please.
Bonjour à toutes et à tous.
Good afternoon, everyone.
With the latest numbers on COVID-19 in Canada, there are now 69,156 confirmed cases, including 4,906 deaths, and over 32,400 or 47% have now recovered. Labs across Canada have tested over 1,108,000 for COVID-19 to date, with about 6% of these testing positive. In the past week, we've tested an average of 26,000 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. We are at the start of another week after celebrating our mothers and caregivers, whether with us in our home, just a virtual connection away, or beloved and unforgettable in our memories. We all share the understanding of the power of their nurturing. So my weekend reflection was on the fundamental human need for this most powerful force of good. Nurturing is that silent catalyst that speeds up the healing of our cuts and scrapes, calms our fears, and gives us reassurance that everything will be okay. This brings me to a very special week of recognition and acknowledgement of some of the other important nurturers in our society. Today marks the beginning of National Nursing Week. We all know that nurses deliver expert care with that special power of nurturing, and we have been very aware of the many sacrifices they have made to be there for their patients in every area of healthcare during this crisis. But their expertise and impact goes far beyond this, spanning every area of health services, from education to the development of standards and guidelines, the delivery of public health programs like vaccination, the implementation of infection prevention and control, and contributing to research and innovation. Nurses contribute to wellness everywhere, and we are also very much better for it. So this week, let's all thank Canada's nurses. Join a 7 p.m. cheer from your driveway. Draw a thank you sign for healthcare heroes in your community, or shine a light in a window for all nurses on Tuesday night, because Tuesday nurses everywhere are commemorating the 200th anniversary of the birth of Florence Nightingale, who revolutionized the field of nursing. It was a revolution that started small, implementing hand washing and hygiene practices to save lives by preventing the spread of life-threatening infections. Then slowly, but with unshakable purpose, she raised the standards and profile of nursing and put an indelible focus on the education of nurses. So in appreciation for the nurturing, daily sacrifices, deep expertise, and unshakable professionalism of nurses everywhere, shine a light in your window on Tuesday night. Thank you. Merci.
Okay, thank you very much, Dr. Tam. Et maintenant, je donne la parole.
And now I give the floor to Dr. New. Thank you. Hello. As usual, I'll start with the latest numbers on COVID-19 in Canada. There are now 69,156 confirmed cases, including 4,906 deaths and 3,100 and roughly 47% now recovered. Labs across Canada have tested over 1,118,000 people for COVID-19, with about 6% of these roughly testing positive. In the last week, we've tested on average 26,000 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. We're at the start of another week after celebrating our mothers and caregivers. Whether with us in our home, just a virtual connection away, or beloved and unforgettable in our memories, we all share the understanding of the power of their nurturing. So my weekend reflection was on the fundamental human need for this most powerful force of good. Nurturing is that silent catalyst that speeds up the healing of our cuts and scrapes, calms our fears, and gives us reassurance that everything will be okay. This brings me to a very special week of recognition and acknowledgement as some of the other important nurturers in our society. Today marks the beginning of National Nursing Week. We all know that nurses deliver expert care with that special power of nurturing, and we have been very aware of the many sacrifices they have made to be there for their patients in every area of healthcare during this crisis. However, their expertise and impact goes far beyond this, spanning every area of health services, from education to the development of standards and guidelines, the delivery of public health care programs like immunization, the implementation of infection prevention and control, and contributing to research and innovation. Nurses contribute to wellness everywhere, and we are all so much better for it. So this week, let's all thank Canada's nurses. Join a 7 p.m. cheer from your driveway. Draw a thank you sign for healthcare heroes in your community. Or shine a light in a window for all nurses on Tuesday night. Why Tuesday? Because nurses everywhere are commemorating the 200th anniversary of the birth of Florence Nightingale, who revolutionized the field of nursing. It was a revolution that started small, implementing hand washing and hygiene practices to save lives by preventing the spread of life-threatening infections. Then slowly, but with unshakable purpose, she raised the standards and profile of nursing and put an indelible focus on the education of nurses. So, in appreciation for the nurturing, daily sacrifices, deep expertise, and unshakable professionalism of nurses everywhere, shine light in your window on Tuesday night. Thank you.
Merci, Dr. Kno. Et maintenant, je donne...
Thank you, Dr. New. And now I give the floor to Mr. Duclos. Thank you, Christian. Hello, everyone. The Prime Minister's main message today was about protection, keeping people safe, a new credit program for large corporations. It is to protect workers and to ensure that their collective agreements are respected. And it is an investment plan to guarantee jobs, given the situation we're living through. And second, we want to establish a solid mechanism, given the situation we're facing, owners and managers. We want to avoid companies from going bankrupt. We want to ensure their pension plans are properly managed. And also, we want to protect the resilience of our economy when we do restart our economy. And we hope this will be lasting, and we need to ensure that large corporations will be supported, but we'll show that they're fighting climate change and have solid environmental measures in place. And they have to guarantee that they're maintaining supply chains, and also with small and medium-sized companies. They are the very fabric of our economy. So all of this is part of the emergency plan that is both fair and transparent and universal. Thank you very much, Christia. Thank you very much, Jean-Yves. We're happy to answer your questions now. Thank you.
Just a reminder that we have a hard stop at 1 p.m. today. So we'll start on the phone with 3 questions, 1 question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Merci. Our first question, notre première question, nous vient de l'inaudible avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour.
Hello, Mr. Duclos. Can you explain the logic behind this support for large corporations and the airline sector, for example? We know that their medium or short-term future may be difficult given the situation. What guarantees can you give that all this money that is going to be spent on these companies and keeping them afloat won't just be for naught, because they will be doing layoffs, they've had to cut business? Answer: these are emergency loans. They're not blank checks. So these loans will be offered to ensure that we can support a transition from this crisis to avoid some of these large corporations from having to shut their doors and lay off thousands of workers. And they won't have to also cut supply chains that are very important between these large corporations and small and mid-sized companies. As I said, they are the very fabric of our economic growth and economy in Canada, and notably in Quebec. So we have to ensure that we protect our economic fabric throughout this crisis, which we need to restart our economy. And we know that this involves notably an emergency loan plan for some of these large corporations. It's not a blank check, and in most cases, these large companies will prefer to continue to get liquidity from traditional financial markets, but they should be able to turn to Canadian government in some conditions, but there will be requirements that will be in place. Question. Thank you. I understood that these were loans, Mr. Duclos, but I'd like for you to explain what will be happening for airlines. Be giving companies funding to airlines. We've seen automotive companies that did not pay back government loans. What is the logic behind helping these companies financially, particularly airlines, when we know that in the short and medium term and even the longer term that they will have less and less business? Answer. One thing that is clear that you say very well, in the short term, we know very well that these airlines will continue to see sizable losses. But we know in the longer term, we will need solid airlines in Canada. And from a structural and a national perspective, these airlines and transporters in general will play a major role to protect the fabric of our Canadian economy. And it is very important to protect airlines and transporters in Canada. We need them to be solid so that one day we'll be able to get out of this crisis. Thank you. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Ryan Tumulty avec le National Post. Please go ahead. À vous la parole.
Yeah, hi there. This question's for Dr. Tam or perhaps Minister Hajdu. I'm working on a story, and I've been talking to people in the health industry here about Canada's ability to produce large quantities of vaccine when or if one is found for COVID-19. I'm wondering if that's a concern for you, if you think the resources are here. I know Canada does produce a lot of vaccine, but those markets those factories are already full of other orders.
Well, thank you very much for the question. And in fact, that's part of the work that we've been doing in terms of working with promising companies across the country, particularly when it comes to vaccine production. Certainly, we have a ways to go. As you know, there is quite a bit of work to do in the space of vaccine creation and then production, but that is certainly something that we're working on. And my colleague, Minister Baines, has been extremely active in this space, making sure that Canadian companies who have either the capacity or the desire to do that have the supports from our government to quickly ramp up. Maybe I'll turn to Dr. Tam to speak a little bit more about where the international community is at in terms of vaccine development.
Well, I think we're still in this sort of relatively early stage where there's a lot of research, which is great news. So I would say over 100 sort of different candidates being looked at right now as potentials, some going into sort of early stage clinical trials. So it is still early stage. But nonetheless, we are engaging all the capacities in Canada to have a look at what is in the realm of the possible. So you don't actually have a sort of lead candidate vaccine yet, but we are absolutely monitoring every one of these and looking at domestic capabilities linked to it. So it is a very rapidly evolving setting, but we're also looking at all the way downstream to, well, when you actually have to vaccinate the population, you have to look at all the supply. So really the whole pipeline from beginning to end is being looked at from a preparedness perspective. But right now, you can't actually say, here is the vaccine that is going to be the most successful. That is still undergoing evolution globally, but we're part of that research internationally. So I think, I think we need to look at every option. Some of the investments that Canada puts in may not pan out to be, in the end, a successful candidate, but we still need to contribute right now and maximize all of our options.
Ryan, follow up?
Yeah, I just wanted to ask too, when I spoke with people in the industry, they say, for example, Canada makes most of its own flu vaccine every year. But there's obviously, well, one, only about 40% of Canadians get the flu vaccine, so this order would be presumably much larger, but also those factories are tied up making that flu vaccine. I'm wondering if, as a public health measure, you'd consider reducing the amount of flu vaccine we make one year to be able to make We Get There, obviously.
I think, it's dangerous to think about things in a zero-sum way like that. I think we can't keep our eye off influenza as highly contagious and also leading to thousands of deaths across Canada. And of course, coincidement of the flu season with a second spike of COVID, for example, could be, from my perspective as health minister, I don't think what we would want to be in the position of having to do is decrease the production of an extremely valuable, extremely important vaccine to increase the production of another. What we're looking to do is expand the capacity and have companies across Canada that can produce, the potential COVID vaccine. I'll also just point out that I think it's really important that we work with the international community on the COVID vaccine. As we know, no country is safe as long as there is one case of COVID. And so Canada has been aggressively working in partnership and including contributing financial resources to the acceleration of discovering a vaccine and the eventual production of one.
I would just add that it's not a very simple analysis, because the COVID-19 vaccine, whichever is a potential candidate, may not be grown on the same platform as the influenza vaccine. So, for example, if you have an egg-based influenza vaccine platform, that might not be how your COVID-19 vaccine is going to be produced. So it depends on the technology as well.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Raymond Fillon avec TVA. Please go ahead. Your line is now open. À vous la parole.
Oui, bon après-midi.
Good afternoon. I have a question for Mr. Duclos. I'd like to follow up on a question that was asked earlier by a colleague to the Prime Minister about the easing of the lockdown. In case of doubt, should we stay at home? Do we have doubts about security? And can I if I do, and I don't want to go to work, can I continue to receive the CERB? Answer, we are in a question where there are big doubts and safety is at question. There are a lot of households, and this is on the mind of many workers. There are basic rules. We have to have a good relationship with our worker, and in appropriate cases, we may need help from public officials in provinces so that we can allay fears and by working with employers. That's the main objective. We want to ensure the safety of workers and also the feeling they have of being safe at work. A large part of our individual well-being depends on our well-being at work. And in this difficult context, which creates both doubts and insecurity, workers need to be supported by their workers, and they expect appropriate measures in this work situation. Question: if the school or the factory where I work opens its doors, I have to reach an agreement with my employer. But at the end of the line, who knows if I'm eligible for the CERB if I refuse to go to work because I don't think it's safe and I have fears? Answer: you say it quite correctly. If I feel that there are health and safety issues at work, I also have the responsibility to talk about this with my employer and to talk about with health officials and experts. If the response is not as satisfactory as I want as a worker, if the basic condition and the employer-employee relationship, it should be done correctly. In that case, the CERB is there to help and support millions of workers financially who do not have the ability to be at work safely with what I've just said, or if they have to take care of a child at home, or if they've lost their job because of COVID-19. Thank you very much. A question from a room now.
Mr. Haidu, we just had Mental Health Week, and I'm wondering, how concerned are you about a secondary mental health, like echo pandemic, that could happen because of all this?
Well, thank you very much, Mike. And it's a great question. We did just have Mental Health Week, and we know that it's not just a secondary wave. It's actually happening right now, that many Canadians are experiencing distress in proportions that we haven't seen in a very long time, whether it's anxiety or depression, increased domestic violence, increased substance use. And that's why we've been so focused on making sure that we don't wait until the resolution of the pandemic to provide resources, but rather they're available right now. And I've talked quite a bit about those resources. I'll just remind Canadians that you can have access to free support through the Wellness Together portal available through canada.ca/coronavirus. But also that site has a number of useful self-assessment tools, resources that you can use on your own, and then connections to paid professionals, whether it's by text or phone. We've also increased money to transfer to provinces and territories, and for both treatment, by the way, as well as mental health supports. And that's in addition to our previous contribution through transfer increases in the last mandate. But there will be more to do, and we know that this secondary pandemic, if you will, is just as in many ways. As a matter of fact, I would say it's just as urgent as this one, because of course people are struggling for a whole bunch of reasons, including our young people, and we need to be all focused at every level of government to help people manage through these difficult times.
Thank you. And you talked about the Wellness Together portal, and I'm just wondering, does it have enough supports there? Do we need to do other stuff? Is there enough funding? Is there anything else we could do better?
Mm-hmm. So far, I've heard good things about the Wellness Together portal, and I know that provinces and territories also as well as access through a variety of different means to professionals in their own jurisdictions. I think there's always more to do to understand what's working and what's not working, and I think the challenge, having come from this sector in some ways in my past, the challenge is that oftentimes there isn't the diversity of tools available for people. For example, the way that we treat substance use is pretty standard, and there are a few different diversions of ways to treat substance use, but there's not the variety that exists that necessarily meets people where they're at. And that work has to continue. And I'm looking forward to having those more fulsome conversations with other provinces, with territories, with providers about how we can all do a better job talking about mental health and mental wellness. I think we also have to, as a society, continue to work on breaking down barriers to talk about mental health in a way that doesn't create that barrier of stigma that still exists for people to talk about how they're feeling. I mean, many people are feeling sad and lonely and scared, and those are okay feelings and very normal feelings to have. And so I think we have to continue to encourage one another to reach out and to speak to our families, our friends, and professionals when we need to. Thank you.
Rachel?
Rachel Haynes from CTV National News. My first question is for Minister Hajdu and Dr. Tam. Schools in some areas of Quebec are opening today, even though the numbers there are still relatively high. How concerned are you that kids right now are going to be used as guinea pigs in this reopening that we're seeing, and does that concern you?
Well, I think as we've all said, and all the chief medical officers agree, you have to do things slowly and cautiously. So I think the Quebec public health authorities are, I'm sure, monitoring this extremely closely to see what the initial school opening would be like from a COVID-19 perspective. But as we just talked about mental health and other aspects of secondary effects, they're also monitoring, that side of things too, not just illness. And it's a complex piece of decision making, but also it's in some ways, have to support parents and individuals for making that decision, and also teachers. And so kids are connected to teachers and their families could be connected to grandparents, for example. So individual situations of risk, I think, are actually a bit different, and that needs to be looked at a more local level. But for sure, I think we know that children on the whole, particularly younger kids, do exhibit milder symptoms and have less of a severe outcome. So I think that goes into one aspect of it, but it is, I know, is a balancing between that and the need for kids, particularly vulnerable kids. I think that's, I know that in the public health domain, people are concerned that closing down schools can only impact those most vulnerable the most. So those are the kids, I think, that they're most seized with. The other thing is that children of essential service workers as well that need maybe some support from a school perspective.
Minister, Hajdu, do you have anything to add?
I think Dr. Tam's covered it well. Thanks.
And as a follow-up to, we are seeing some very large cities that are opening up, like Toronto, for some curbside pickup. But there are still, again, high number of cases there, more so than in other places of the country where they are not reopening yet. Even New Brunswick had pushed back some days of school opening. So are you concerned about this perhaps imbalance of openings that we're seeing across the country?
Well, thank you very much. I think that each jurisdiction is using the guidance framework that the provinces and territories with the Prime Minister worked out to make their own jurisdictional decisions based on the complexity of considerations that Dr. Tam has outlined. These are difficult decisions, and of course, premiers and local politicians are weighing decisions about how to resume some functioning of their communities while also protecting people's wellness. And I think, as Dr. Tam's talked about, the decisions are being driven through epidemiology that's very local in its context, and through a risk assessment process at the provincial level. And I think when Dr. Tam talked a couple weeks ago about the downside, coming down the curve, coming down the peak, I think that's where we're at. I think all premiers and all municipal leaders understand that there will be a period of adjustment and that we will have to be taking these decisions carefully monitoring the outcomes of these decisions and adjusting them. And I think we can anticipate that there will be adjustments as we go through the next phase. Because, of course, this is a whole new way of behaving, not just for leaders, but also for the citizens that live in those communities. I think there are some very simple messages that Canadians can take with them always, no matter which jurisdiction, which is wash your hands, don't go anywhere if you're sick, and make sure you keep your distance, your 2-meter distance from people, and give people distance when you're out in the community. And I think that will help also to reduce risk for community. Thank you.
Tonda?
Good morning. Minister Freeland, the Premier of Ontario, Doug Ford, on Friday was very adamant. He doesn't want to see the U.S. border reopened anytime soon. Can you address his concerns about that, and given that the agreement, I guess, comes up in a week? And very specifically, he said, and if you go about relaxing restrictions at borders for travel, there needs to be tenfold screening at airports and whatnot. So what plan has your government got in place to address those concerns?
Thanks for the question, Tonda. We had a very good conversation with the premiers on Thursday at the now weekly First Minister's call about borders in general and the Canada-US border in particular. We are really daily, even hourly, reviewing and working on and monitoring the border situation with our U.S. partners. The Prime Minister was very clear today, as he is every day, that we believe in acting out of an abundance of caution, that we believe it's very important not to squander the gains that Canadians have sacrificed so much to achieve. And we are going to be taking that prudent and careful approach when it comes to reviewing our border agreement with the United States. The premiers, very much including Premier Ford, offered some very useful input in the conversation on Thursday, and we're having ongoing conversations with the Americans.
I'm not sure that was an answer, but okay.
Yeah, no, Tonda, actually, that was an answer. What I said was that we are working closely with the Americans, that we're taking a cautious and careful approach. And we had a great and very useful conversation with the premiers who, by and large, share this cautious view.
So is there a need for tenfold increase in screening at borders, as Premier
So
Ford
when it comes
said?
when it comes to the second part of your question, actual measures that are in place at the border, right now the situation is working well. In fact, I think particularly at the Canada-US border, the distinction between essential and non-essential travel has managed to achieve our two objectives of keeping Canadians safe and at the same time allowing those essential goods and services to continue moving freely across the border. So that has worked and that is working. Of course, inevitably, as our economy starts to open up, something that we've been talking about today, even absent a single change in Canada's border restrictions, we will see more travel across the border. We'll see more Canadians choosing to go back and forth, and we'll see more business activity, which will mean more essential travel. And that does mean that the federal government will need to do even more at all of our borders to keep Canadians safe and well. And that is something that we are working on right now and we're very focused on.
Thank you, Deputy Prime Minister. We'll now go back to the phone for 3 questions. Operator.
Thank you. Merci. Our next question, notre prochaine question nous vient de Hélène Buzetti avec Le Devoir. Please go ahead. À vous la parole.
Oui. Good afternoon, Mr. Duclos. I'd like to go back about the question you were asked earlier. My colleague from TVA asked you about something. We're restarting the economy. There are employers that are calling their workers bad. And in some cases, workers don't think things are safe. I understand that you are trying to encourage a conversation between employers and employees about work safety. But if they don't reach a mutual understanding and the worker still doesn't want to go back to work, should they receive the CERB or not? Answer. Thank you for your question. The CERB is there to help workers in 3 types of circumstances. First, if the worker has lost their job because of COVID-19. Second, if this person needs to take care of a child at home. And third, if this person needs help to ensure their health and safety. And that is what the employer-worker relationship reposes on. The employer has the responsibility not only to guarantee the health and safety of the worker at their normal workplace, but also they have to ensure that that worker has the feeling and the reassurance of safety and that their health will also be protected. In all cases, this reassurance and this feeling of depends on an important conversation between the worker and the employer. And as I said, this conversation may need to be supported by directives and additional information from health officials and health and safety officials across the country and notably in Quebec. So it really depends on an individual context. Question. You're still not answering my question, so I'm not going to lose my time talking more about that, but I'd like to hear what you have to hear about the student CERB. The bill was adopted almost 2 weeks ago. There's a certain amount of latitude being taken. We've heard that students will be given available jobs and that they will be able to earn a certain amount of money and still receive this assistance. Do you have anything more to say about that? Answer. 2 things. The emergency support first offered in a much broader context. There are solid measures to increase jobs available for students. Many students will have a hard time finding a job. They'd like to find one rather than receiving the CERB for students. And therefore, we established measures to support internships, volunteer work for students so that we can support community organizations. There's this Canada Summer Job Program. So there are certain measures that will be there to enhance jobs, increase the jobs that are available, but there will still be some students that won't be able to work in coming months. So the second thing that will soon be done in cooperation with Madame Leboutillier, the Minister of Revenue, and Ms. Qualtrough, the Minister of Employment, is to announce on a site that will be on the CERA's website will be a mechanism for that students be able to receive the student CERB. Thank you, Minister. Next question.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Laura Osman with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. This question is for, I think, Minister Hajdu and perhaps Dr. Tam. Some experts have expressed some concerns about the way Canada gathers important health data, particularly related to deaths that could be causing a delay in getting important epidemiological data, like excess deaths, for example. Death certificates are done on paper in some areas. So why is this process so behind in Canada, and is it hindering Canada's ability to gather that important data that other countries seem to have ready access to?
Yes, so we are in the process of looking at that kind of data with Statistics Canada because it's not just about COVID-19 deaths. It's also looking at some of the other impacts. So that is actually something that is taking place. As well, we are in contact with medical examiners to look at what they can contribute to as well. We started that, building that capacity as part of our ongoing crisis in terms of drug-related poisonings and overdoses. So we are going to try and link with that platform as well. But it's a very important point, and there's a number of pieces of data that we're looking at right now to look at those in parallel or unintended consequences.
Laura, follow up?
Thank you. Other countries seem to have a more automated process for getting this kind of information. Is Canada's platform sort of behind the times on this?
Well, I think we have highlighted some of the gaps in sort of real-time information on the COVID-19 deaths themselves. So I think we are doing our very best with the provinces to try and see if we can address those gaps. So I think that's clear, particularly in the area of this aggregated analysis that we've already talked about, I think in the last several days. So that is something that we do have to work with. But I think with Statistics Canada, we'll look at some of the other statistical analyses. And, I think it's interesting in that the reporting of deaths is actually not that real time overall when you consider the fact that that's a very specific outcome. But it's something that we're looking at to see if there's different ways in which we can address that. But I think excess mortality is something that we have to look at right now in parallel with the COVID-19 deaths.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Alex Bollingal with the Toronto Star. Please go ahead. À vous la parole.
Hi, thanks for taking my question. I think it's for Minister Hajdu. We've seen, based on analysis by some of my colleagues in Toronto, that in Ontario, private or for-profit long-term care homes have had significantly more deaths from COVID-19 than public ones. I'm wondering what you think of that, and if in the reviews of our long-term care system and how we care for vulnerable people in Canada, if looking at changing the way that for-profit care is allowed, whether that would be bringing it into the public system, if that's something that you think should be looked at and done.
Well, thank you very much, Alex. And I think this health crisis has really shone a light on some particular vulnerabilities in long-term care. And obviously, data is starting to emerge about certain characteristics of long-term care that have created even more risk for people that live there. I think our government is very open to reviewing how long-term care is delivered in this country and working with provinces and territories to strengthen quality of life and safety for seniors that live in congregate living settings. And I would say all congregate living settings, although there's a heavy focus on long-term care, there are other groups of individuals that live in congregate settings that also are vulnerable and have, in some cases, substandard care. I'm thinking people with disabilities, for example, or other special needs that may be supported in group settings. But in particular, in terms of long-term care, I don't think there is a minister amongst us that would disagree that we need to do a better job and that the federal government can play some leadership role in this. And we are having those conversations as we speak. How we, not only in terms of how we renew that system in the future, but also how we better support long-term care right now, regardless of how that care is delivered or under what model, to ensure that seniors are safer in their homes.
Alex, follow up?
Yeah, just does that what those discussions include looking at bringing them into public health care or bringing them out of the Canada Health Act? I know the NDP leader is calling for that. Would that be something that you guys are looking at?
I think right now the first focus is to get through the crisis and protect seniors who are in these homes, regardless of the model, in a much more robust way, working in partnership with provinces and territories. And that's exactly what we've been doing, as you know, whether it's through support through human resources. The military is actively involved, as you know. We're working with the Red Cross and supporting the Red Cross to deliver services through the provision of personal protective equipment or helping care homes to acquire personal protective equipment, etc. I think the longer conversation is what do we need to do collaboratively with provinces and territories to move from a place of guidelines to a place of standards. And I think that's the important conversation that needs to happen. I would say right now we are so focused on the urgent, immediate need to save lives in these places that we are not having the fulsome conversations about how to reform the system, but it's certainly on our mind. And I know that it's on the minds of the premiers of the provinces and territories as well, because as I said in my first response, this COVID crisis has shone a light in an area that needs dramatic reform.
Thank you, Minister. Ceci met fin à la conférence de presse.
This ends our press conference for today. Thank you.